O'clock on March the 12th. This is Sadiq Khan bringing you your latest edition of Speak to Sadiq on LBC. I'm here for the next 30 minutes or so, taking your calls. So this is your chance to put any question you like to me, the Mayor of London, and I'll do my best to answer. So the numbers for you to get your questions on the air are 0345 6060973, or you can email sadiq@lbc.co.uk, or you can text on 84850. Don't forget, you can also watch Speak to Sadiq on the website lbc.co.uk or live on the LBC Facebook page. Good morning, James.
Good morning, Mr. Mayor. No prizes for guessing what we will begin with. I'm going to exercise presenter's prerogative here to steer you immediately towards coronavirus. It's clearly a public health crisis. Probably on an unprecedented scale, and it is clear, although neither right nor wrong, only time will tell, that this government, the current government, has elected to pursue a slightly different path from most comparable countries, actually, not just European countries. I know that you were excluded from the Cobra meeting originally. Is that still the situation as the mayor of a city with 9 million people in it?
It is for the time being, yeah.
Okay. Does that surprise you?
It's a bit odd. I mean, for the reasons you've said, we're a global city. I'd argue Europe's only global city.
Have they given you an explanation? Have they said sort of?
No, they haven't. But the good news is I've got access to the experts that advise the Prime Minister around Cobra, from the Chief Medical Officer to the Chief Scientific Advisor to Public Health England. It is odd, but rather than me having a barney with the government about excluding me, I mean, I've made representations. There's another meeting today. I've asked again and explained the reasons why it makes sense to me for the Mayor of London to be there. Other Cobras with other Prime Ministers, I've been there to discuss and assist and help. We're on the same side here.
Conservative Prime Ministers?
Yeah, David Cameron, Theresa May. And to be fair, Boris Johnson, before the general election, when we had the awful attack at the end of November on London Bridge, but he and his advisors have chosen to exclude the Mayor of London. But look, I think I don't want to quibble about not being at Cobra. The key thing is to make sure that we are following the expert advice that we have. And look, I'm the first person to criticise the Prime Minister in the past.
Yes.
When he's failed to follow expert advice. I think on this occasion, as long as the advice is tested and challenged,
we learned yesterday that the direction of traffic is being governed by this nudge unit in Downing Street. It's more behavioural science than medical science. Let me ask you, and again, I fully appreciate that the line between illumination and activism is quite thin at times like this. But my listeners, we established yesterday, are very, very keen to know, as am I, whether or not the medical advice given to government is filtered through the lens of political considerations. Perfectly normal and understandable political considerations, but this tension between health and wealth, between the medical and the economic impacts. When they talk about following the science, they're not mentioning that a lot of this science is behavioural. So the British government has gambled on how best to tackle this. And I mean, up until this morning, the only country in the world that seemed to be doing as little as us was America.
Well, some of the points you've raised, the points I've raised with the experts that I've met, and I yesterday spent a lot of time with the Chief Medical Officer with his advice undiluted by number 10 or by a behavioural unit at number 10 or a nudge unit.
It definitely is. So what he says to you, what Chris Whitty says to you is absolutely Chris Whitty's explicit expert opinion.
Yeah, it is.
That is a massive relief, man.
It is. And can I say this? Look, the reason I was alluding to the Prime Minister is, look, I think to be fair to him, and it's unusual for me to use those words, he is following the advice from the Chief Scientific Advisor and the CMO. You're right, though. There is an issue of judgment. I don't think any of us politicians should follow blindly the advice of experts. We should test it and challenge it. And what the Chief Medical Officer explained to me, and I've also been speaking to other experts from Public Health England and his deputy, is that the key challenge has been over the last few days and weeks to contain it, to avoid the spread too soon, and then to try and delay the spread. And so what I expect to hear from the Prime Minister, the Scientific Advisor and the Medical Officer, the Chief Medical Officer today, is we move into the delay phase, which changes our response. And actually, one fatality in London is one too many. 8 fatalities across the country is 8 too many, but it will go up. And the key thing is to make sure we can contain it, delay it, and get to spring and summer, which means less pressures on the NHS, but we'll be able to hopefully deal with the virus better in spring and summer than we could in winter. And, you know, the advice from the Chief Medical Officer is that if the advice changes, I will make sure I let Londoners know. What I won't do is keep Londoners in the dark. And so, for example, if the chief medical officer was to advise me to change advice on the tube or the buses.
But this is what I wanted to come to. What autonomy do you have? Because the mayor of New York is I mean, one of the things
the governor is.
Beg your pardon. Is able to act autonomously. That's the nature of the federal government in America. But what can you do? What could you do? Can you shut the tube individually, independently?
Yeah. So I'm in charge of the tubes, the buses, the trams, the overground in London, not the commuter trains. And one of the first questions I asked was, how safe is our public transport? The advice I received, it is safe, we should go about a normal business, but regularly and thoroughly during the course of a day, wash your hands with soap and water for at least 20 seconds. If you're going to cough and sneeze, try and do it in a disposable tissue or your arm if you've not got a tissue. That's the advice I received. Notwithstanding that, we enhanced our cleaning regime at TfL from last Friday. So previously we used antibacterial disinfectant. From last Friday, we're using the stuff used in hospitals, antiviral and antibacterial disinfectant. And we're testing this long-lasting 30-day antiviral disinfectant, which we hope to roll out in the course of the next few days and weeks.
Two more questions on this maximum, I promise. The first, just to steer you back to the official medical advice. Do you understand why we are doing things differently from... I mean, one doesn't have to reach for the extreme examples of China, where I think 93 million people have been put into effective quarantine, or indeed Italy, which is now a nation in lockdown, but places like Austria, which have fewer cases than us, but have already moved to close down large public gatherings.
So a number of explanations given by the CMO and public health in relation to this. Italy and China started in one place and spread. Our country is a bit different. It didn't start in one place and spread. It started in different places for a variety of reasons. People travelled to North Italy or China and went elsewhere. So quarantine in one area doesn't really work for our country. Put aside issues around whether it's realistic about doing that. That being said, London is a bit ahead of the curve as far as the rest of the country is concerned. So you'll have seen 1 in 4 people, roughly speaking, is testing positive. So global figures for London, total figures for the country, about 460. London's about 108.
So this is a percentage of people tested.
I beg your pardon. Yes. Yeah, that's right. Fatalities, one out of 8. And so the response from the government so far has been one that deals not just with the country, but specifically London. And so we'll be seeing, what we're not seeing in our country is what you're seeing in China and Italy is regional advice, what you're referring to. So the advice in Italy was first quarantine, lockdown the northern district. When that didn't work, the whole country. We're not doing that for the simple reason the history of the virus in this country is different to other parts of the world. But this is always kept under review. If the advice changes, we'll make sure we change what we do on the ground.
And finally, can you make any sense of Donald Trump's latest pronouncements?
Far be it for me to question the wisdom of what President Trump does. It is a bit odd that those who have been in the Schengen countries are banned from going to the USA.
Is unless you're a US,
unless you're
not definitely not.
No, you could be a US citizen and you're allowed to go into the USA, but if you're from the European Union, you're not. Or if you're British, you're allowed to go. And so, I fear.
If you're French, you could just fly to Dublin or London and hop on a plane to America from here.
Well, I fear this is another example of policy on a whim rather than on evidence, and so it is a bit odd. And also, the numbers of people tested in the USA is very small.
Yes.
The one thing we do know, which is unarguable, is the number of deaths. There's an issue about those who are being tested, and we know in some states, because of the federal system, they've not tested hardly anybody, so we've got no idea how many people have been tested positive to the coronavirus. All we do know is where a coroner or a medic actually attributes coronavirus as one of the causes of somebody dying. You'll be aware from the evidence, coronavirus by itself is not usually the reason why somebody loses their life. They have underlying health conditions, and coronavirus is one of the causal effects for the death. And so we're not sure, because America's been very slow to respond. Donald Trump's been in denial in relation to this, and his policy last night is a bit odd. And another example of policy on the hoof rather than based on evidence.
Very reassuring words. Thank you.
Thank you.
Mr. Nash. Shall we hit the phones?
The first caller is from Heathrow. It's Dave. Good morning, Dave.
Good morning, Mayor Khan. Good morning, James.
Hello,
just a quick question.
Please.
Are companies in London obliged to let you know if they have a case of coronavirus, i.e. in the transportation business, private hire companies, do they have to acknowledge that they've got a problem and inform you and inform their customers, or can they just ignore it and just let bygones be bygones and just let it drift away?
That's a cracking question, Dave. I tell you why it's a cracking question.
It is a cracking question. Thank you, Dave.
This was my concern in advance of the budget. Let me tell you my concern, Dave. So the answer is no, they're not obliged to. Let me tell you my concern. I know, because I meet them regularly, some of them are my friends, people who do 2 or 3 jobs during the course of a day. They work in the gig economy, and they basically, most of them are self-employed, and they live hand to mouth, and if they don't work, they can't put food on the table. And my concern has been, Dave, those of us who are lucky to be employed and have decent employers can take time off and self-isolate, even though we're not diagnosed with the coronavirus and will get sick pay or proper full pay. My concern has been, what about those who need to work to put food on the table? Because you can understand the temptation not to self-isolate, and if you're feeling a bit fluey or coughing, just go on and work in. And so although I welcome in broad terms the general package of measures announced yesterday from the Bank of England and the Chancellor, he's not addressed, the Chancellor, the concerns around the people you're talking about, and also the perverse incentives to carry on working and therefore be a spreader without knowing it. And so, for example, if you're doing 2 or 3 jobs, having statutory sick pay doesn't help you even from day one. We know the delays in applying for benefits, whether it's ESA, which the government announced yesterday, or universal credit. And I fear, Dave, that many people working in the private hire sector, in a gig economy, will carry on working, not because they're nasty, evil people, but because the choice they're making is putting food on the table or spreading the virus, and it's an invidious choice they're making.
Specifically to answer his question, then there is no compulsion for companies which kind of makes sense given...
No, so you could be somebody who's delivering food, and the other irony, Dave, is if people are self-isolating, they're probably more reliant upon food being delivered than others, and if they decided for whatever reasons, I don't agree with them, not to use public transport and are using private hire drivers, again, they're in close proximity. So no obligation, James, for somebody to let either Public Health England, the CMO, or the Chief Scientific Officer of the government know.
When I said that makes sense, I meant looking at the evidence, your answer makes sense. I didn't mean that necessarily having a status quo where companies are not in any way compelled to reveal infection made sense. Should we crack on? There was just one other area that I wanted to touch on with regard to this, but I think I've asked you enough questions. Let's go on.
Thanks, Dave, for your question. The next caller is from Andy. Good morning, Andy.
Good morning. Good morning, James. Good morning, Sadiq.
He doesn't know how to pronounce your town because he doesn't spend enough time in the Fens, Andy.
Andy, listen. Are there many London voters in the Fens?
I'm not normally from the Fens. I'm travelling there.
Wisbech.
So normally I'll be in Welwyn Garden City.
Carry on.
Yeah. So the question, well, it's not really a question, but
it needs to be. Andy, it needs to be a question. It's pretty straightforward.
Right, okay. Yeah.
Andy, start by saying, do you agree, Sadiq?
Okay. So, is it normal for London mayors to be involved in Cobra discussions, i.e., so would Boris Johnson have been called to a Cobra meeting? Would Ken Livingstone have been called to a Cobra meeting? Because you're implying that in some way you've been isolated from the discussion.
We've already answered this. I don't know if you were on hold, but we'll do it again just for you.
Yeah, Andy, I've been to many Cobra meetings, and one of the things that impresses me about when there's a national crisis, whether it's a terror attack or something else, is how governments put aside party politics and we work really well together. And I've given praise to previous prime ministers, Tory prime ministers and home secretaries and defence secretaries for working closely with the Mayor of London. Put aside me as a personality, it's the office of Mayor. We're a global city, and so it is the normal practice, Andy, for the Mayor of London to be around the table. And sometimes the Scottish government and the Welsh government feed into the meeting through satellite links if they can't turn up in person for obvious reasons. It is odd, but I've got to go about doing my best as the Mayor with the evidence I've got. And so we're in contact with Number 10. Each time they've held a Cobra, today's the third one, and I've got wind of it through the media. I've said, hold on a sec, shouldn't the Mayor of London be there? Not in a pompous way, but shouldn't I be there, bearing in mind Heathrow, Gatwick, Stansted, City Airport serve our city, Eurostar serves a city, we've got a diverse population, and the answer is no, you're not invited.
Should we crack on?
The next caller is from Wandsworth. I do know how to pronounce that, James, it's my manner. It's Joe. Good morning, Joe.
Good morning, Sadiq. Morning, James. Thank you for taking my call. A very quick question that I'll frame in the sense that we're attending as a family a large event at a large venue, closed venue, theatre venue in London this weekend. We're also due to travel to Poland, and we've had advice from the government website today saying that from the 12th of March, cinemas, operas, theatres, museums and other cultural venues are going to be closed indefinitely in Poland. Poland, as you may or may not be aware, why would you know instantly, has 22 cases, according to the World Health Organization, of the COVID-19 and no deaths as yet. Yet they have taken as a government that decision. Sadiq, what's your view? I know you talked about this earlier on, but don't you think we should be actually moving more robustly into taking similar action?
See, I said your words were reassuring, but this confusion sustains, doesn't it?
The question you're raising, Joe, just for the sake of candour, has been asked of me by numbers of people over the last few days and weeks. There will always be, in anything, differences of opinion. I say this as a lawyer. Put two lawyers in a room, you get two different opinions, or two journalists, or even two medical experts. The way this coronavirus works, what we know is, think about a bell curve with a line slightly increasing, and suddenly a big bell curve, an upside down U, and then going down. Now, what the British experts are seeking to do, and they speak regularly with the World Health Organization, who've declared a pandemic, is trying to contain, delay, and mitigate. But by that they mean trying to push this bell curve as late into spring and summer as is possible, and try and keep the peak down so the upside down U isn't as high as it could be. And they're using a number of tactics to do so. No two countries are the same, because you've got to look at the genesis of the coronavirus coming into the country, how it's spreading. So in Italy, it was through North Italy. In China, it was in the Wuhan area and on. In our country, it's different parts of the country. So it's not really comparable to compare the UK with Poland, or with Italy, or with Iran, or with South Korea, or with other parts of the world. One of the very basic reasons is our laws are different. So what the advice from the chief medical officer at the moment is, go about your normal business, but take prudent steps to make sure we can reduce the chances of catching the coronavirus by washing your hands thoroughly, sneezing into a tissue. And so the advice at the moment is, there is no, unless you've got underlying health conditions, respiratory issues, or you're very old, there's nothing to worry about going into a confined space, either indoors or outdoors, as long as you take those steps. So, for example, the average person, an amazing stat, Joe, the average person touches their face 7 times in a minute. James is doing it right now. Nothing wrong with that. But if your hands are dirty, if you've shaken the hand with somebody who's got the coronavirus, you could inadvertently be accelerating you yourself catching it. So that's why, my hands are on the table as I'm speaking, because I always touch my face. I've stopped shaking hands some time ago because I'm often out and about campaigning or going to venues and I can't wash my hands regularly. So those are the sort of sensible steps the chief medical officer, the chief scientific advisor, and public health England have advised. And I say this, and James not unreasonably asked me the question, is this through the filter of political calculations been made, or concerns around the economy? Fair questions.
Yes, but feasible considerations. I'm not suggesting
very fair questions.
Negative.
These are very fair questions, Joe. And can I just reassure you, I'm not hiding stuff from you, because yes, I'm worried about the economy. Yes, I'm worried about the takings in the theatres and the tubes and all the rest of it stuff. I'm not hiding from you the advice I've received from the experts, and I have tested it, just like you're testing me and James is testing me as well. That advice may change in the future, though, Joe, which is why as soon as I receive different advice, I'll make sure I pass it on to you.
I suppose, to be clear, and there's a lot of compliments coming in today for your clarity. To be clear, there is a fear that Donald Trump has done the wrong thing for the wrong reasons. But if we turn out to have done the wrong thing, it will not, in your view, have been for the wrong reasons. And that is oddly reassuring.
Can I just say this, James? I am the first person to criticise Boris Johnson.
Yes.
Honestly, for me, it's pleasure and business. I can't fault the Prime Minister for following the advice from the Chief Scientific Advisor and the Chief Medical Officer. And I make this point, and it's a serious point. We criticise Boris Johnson for only doing interviews with journalists who are his mates, right? To give him credit, he's had 2 press conferences. On his wings has been the Chief Medical Officer and the Chief Scientific Advisor, and he's taken questions from journalists who even aren't his mates. And that, I think, should be welcomed, because members of the public, whether it's Joe, whether it's you, whether it's others, whether it's my family, have got genuine questions that deserve answering. But here's the point. Should the advice from the experts change, we as politicians have got to change our advice to the public. And this will be a long process. It could take from 13 weeks to 20 weeks, and we've got to make sure we can pivot to different advice we receive from experts. At all times, we've got to test the experts. Don't just take blindly what any expert says, whether it's a dentist, a mechanic, or a chief medical officer. And I'm testing them.
It's good to know. When's the election? Is it May the 7th?
It's May the 7th, yeah. Actually, one of the questions I asked, you'll appreciate this, James, and apologies for, and please indulge me if you don't mind. One of the questions I asked the Chief Medical Officer was, is this election still going to take place for obvious reasons?
Yes.
And his advice was quite clear, and it stuck with me. He said, there is no logical reason to postpone or cancel the elections. If somebody is worried about going to polling station, it's really important to make postal votes as easy as possible. If there is a very small risk, the way to make that risk even smaller in relation to spreading the virus is wiping the pencils.
Really?
With a wipe. Yeah,
individual pencils.
Yeah.
It makes perfect
wipes,
sense because anything where you can leave germs is.
But you can always wash your hands after you've voted it and stuff. And some of the candidates on the ballot paper, people may want to wash their hands after they've chosen to vote for that candidate. But the key thing is the advice from the experts. No logical reason to postpone or cancel the elections.
I'm still confused, and I'm going to take a punt on being representative of many people listening on this one, because these comparisons with other countries, and a lot of people are encouraged by your confidence in what this government is doing. I understand most of what you've said about the starting point being a reason why the responses in Italy and China have been very different from ours. But, as other callers have reminded us, Poland and Austria and other countries, Italy even, are going much further. Sorry, not Italy, Germany are going much further, much quicker than we are. And I understand the notion of postponing the peak for as long as possible. But I don't understand why there hasn't been more done to track people coming here from countries that are infected. We've heard stories of people being taken from planes with symptoms while everybody else on the plane just sort of waltzed through customs unchecked and unchallenged. Everybody wants this to be done in the least damaging way possible. Everybody is conscious that you have to be very careful what questions you ask and what criticisms you make. But this gulf between how we are behaving and how everybody else is behaving can't simply be explained by talking about where the starting point was. Because if we've got more starting points and they only had one, then logic would surely dictate that we'd go even further than the countries where they can track it down to one starting point.
So one of the reasons why I was frustrated not being at Cobra was because there are 4 airports that serve our city at least. Heathrow, Gatwick, Stansted, City plus the Eurostar.
I think Southend's a London airport officially, according to some travel agents, but it's not in your patch.
So's Luton on London. Yes. I had the same questions that you had, and I've had to ask them indirectly because I'm not at Cobra to ask these questions. So what I've been told, which I'll relay on to you and your listeners, is at the start of the contain phase, it was really important to try and contain as many people who may be in areas where they could have got the virus. As we've moved on, we're going to very shortly move into the delay phase. Actually, the issue is to delay the spread. And so from next week, I suspect maybe later on this week, even if you've not been tested positive for coronavirus, if you've got a cough or some of the symptoms, you'll be advised to self-isolate for 7 days. In those circumstances, there is no need to test because you're taking the prudent, sensible measures to self-isolate and to keep a distance. You raised a separate point around contact tracing. The question I asked when I had my first meeting with the expert was, hold on a sec, say if I've got the coronavirus and I'm on the tube for an hour, changing carriages because I changed lines, how are you going to contact trace everyone on the carriage in the tube? And the answer is a bit of pragmatism and being realistic. It's not possible in every case to trace who you've been in contact with. And the live example is Nadine Dorries. I wish her well, hope she makes a speedy recovery.
Same.
But it's very difficult to trace every single person a busy minister will have had contact with. We can do our best, but we've got to be realistic. The numbers we're talking about, we can't test everybody, but we've been testing more people in our country than many other comparable countries. That's why you compare the numbers of people tested positive in a country of 66 million versus a country of 300 million, the USA. People can have some confidence. And we've done that at the contain phase, and we're going to move on to the delay phase. But the other point is this, James, we've got to be realistic. This is not about nudge behaviour, this is or behavioural science, but this is a virus that will last for many, many, many weeks and probably many, many, many months. We've got to be realistic about what we can expect from people. So, for example, those who said we should have closed our schools down 2 weeks ago, that means closing our schools down basically for 20 weeks plus. Often it'll be grandparents, elderly, with underlying health conditions who'll have to do the childcare. Children so far have not been tested positive, thank God, for the virus, and there's been no fatalities, thank God, of young people. So you could inadvertently been making matters worse by taking actions like closing down schools. So if you stop the tubes and the buses running, people will take, different steps. They may start driving into central London or doing other things which spread the virus. If you cancel sporting events and people go to a pub and watch a sporting event in the pub, you're more likely, if there's somebody who's got the coronavirus in a pub, catch it, than when there's 70,000 people. So these are some of the calculations that are being made. Some of it's a question of judgment.
Of course, but if, as is possible, if not probable, a lot of what you've just said is reversed later today, particularly with regard to these public gatherings, how on earth are people supposed to derive comfort from a complete U-turn, which is what America has just seen?
No, to be fair, it's not a U-turn. I think we may move in that direction. It's about phasing, James. So it's contain, delay,
yes, but if
mitigate.
You're at more risk in the pub than you are at a football game today, then you will still be at more risk in the pub than you would be at a football game after the delay.
Absolutely. My point is, the longer we can contain this virus, so we get the peak, as I said, moving on towards spring and summer, the better the NHS is prepared to deal with it. The more we've put in place mitigation measures as well. And so nobody's pretending, certainly not me and certainly not the Chief Medical Officer, that we aren't going to reach a peak. That upside down U that I refer to, the bell curve, we're going to get there. The key thing is try and push that as far as we can to spring and summer, but also try and get the peak down by the combination of containing and delaying.
Good. I just want to praise you then, your position. You're more or less, despite being excluded from Cobra meetings, you are, as Mayor of London, more or less foursquare behind Boris Johnson's government's response to the unfolding coronavirus crisis, while your mayoral rival, Rory Stewart, the independent candidate for mayor, is adamant that they've got almost everything completely wrong.
That's a fair summary.
And that's a coincidence.
Well, look, can I say there is a motive for me to try and criticise Boris Johnson.
Yes.
Having a dividing line with a Conservative Prime Minister makes political sense. I ain't going to do it, though, for that reason.
Fair play.
Where I agree with Boris Johnson, I'll say I agree with him. Where I disagree with him, I'll say I disagree with him. I agree with the Prime Minister.
Are you scared?
I'm scared about, when I see one fatality, it's heartbreaking, because that one person who died in London has got a family and friends. And so, yeah, I'm scared about numbers. 8 people have died already from the coronavirus. It's no comfort to me that 8,000 died from the flu last year. That's no comfort to me. Anybody dying an illness that they may not have caught is upsetting and is scary. The bad news is there is no vaccination for the coronavirus. The bad news is there's no antiviral treatment. So what we've got to do is try and contain and delay as long as we can. As Dr. Tedros said from the WHO, this is a global pandemic, and we've got to do what we can as a developed country to mitigate the worst conditions that the coronavirus could spread.
Let's try and squeeze in a couple.
Thanks, James. The next caller is from Hammersmith, and it's Sally. Good morning, Sally.
Dame Sally.
I beg your pardon. Oh, hi, Sally. How are you?
Who is this?
Hi, James. I'm a first-time caller.
Oh, you? Well, thank you. Can you please tell James it's because of me you've rung in as a first-time caller, not him? That would make my day.
Vanity of these people.
Well, actually, that's not true.
Sally, you break my heart.
Fake news.
but it's a bonus that you're there.
Thanks, Sally.
Fair enough.
Is that all right?
Yes.
Is that enough?
Yes, it is.
Right. Sadiq, as you know, my husband was a colleague of yours.
Yes, Ian.
He was the MP for Hammersmith and Fulham, and he's had a series of strokes. My voice is shaking, I'm sorry.
Yes, it is.
He had another stroke 2 weeks ago.
Oh, I'm sorry, Sally.
So on my day off from work, I'm not working this week, so this is why I've been able to speak to you. On my day off from work, I spent 10 hours in A&E. And I advised the NHS not to admit him. And they discharged him. They were fantastic, by the way, fantastic.
Right.
They discharged him at 11 o'clock at night. So we were up, putting him to bed again. He is now bedbound. My local authority is the best local authority in the country. Ian, as you know, was the leader of it. We have free social care. We don't pay for our social care. We are very lucky. But I have heard no advice from anyone what I should be doing to protect my husband. And I can't afford to let him die because my son could not bear losing his father. And I was so pleased with the budget yesterday, but What's happened to the social care element? There are millions of other people out here in my position. We can't go to hospitals. What do we do? Well, how do I protect my husband?
So it's Sally, it's housebound, vulnerable people with severe care needs who you feel are simply not being properly advised at the moment.
Yes, they're not. No one said it. My GP hasn't contacted me. The council hasn't contacted me. How do I get this advice? I can't find it.
Sadiq Khan?
Well, I know Ian Coleman and Sally, and Sally, your call is very distressing. Look, one of the things that concerns me, and I've spoken to council leaders about this, and it's a big concern they've had. I was speaking yesterday to the leader of Camden and Southwark and Newham, is the issue of social care, because many people who work in social care work incredibly hard. They get paid the minimum wage. Many of them, if they don't work, don't get paid, and it's a big concern councils have, because you're right, Hampstead and Fulham is a fantastic council, and there's a real concern about, after 10 years of what we've seen with social care, that they haven't got the resilience to deal with the coronavirus. That's one of the areas that we are concerned about. And so just so you know, Sally, it's no reassurance to you and Ian, but just so you know, we've convened a strategic coordinating group where you've got all the chief executives and council leaders meeting. There was a meeting yesterday of chief execs, because council leaders know about the experience of people like you and Ian, to see what steps they can take to help you. There was no announcement yesterday, as you all have noticed, in relation to social care. And separately, one of the points my health advisor made to the chief medical officer is GPs aren't receiving on a daily basis advice from CMO or Public Health England. And the CMO, Chief Medical Officer, agreed to go and look into that. So, Sally, why don't I do two things? Why don't I separately get in touch with you after this to see what we can get from the council and you to make sure you and Ian have got the advice you need. But separately, I'll speak to the strategic coordinating group to make sure we can expedite the advice that the government should give to chief executives across the country, because you are right. There are many Ian Colemans, or there's only one Ian Coleman, but there are many people who are suffering. There are many people who are in the same position as you, but for the grace of God, it could be James or me. So, Sally, bless you, and please give Ian my love, and I'll separately get in touch with you. And I promise, as an action, to see what the chief... They were meeting yesterday, by the way, Sally, honestly. They were meeting yesterday afternoon.
Thank you, Sadiq.
Yeah, and I'll follow that up.
And the worst thing is he can't go to the Arsenal.
Well, I know that Arteta's turned it around.
Every cloud has a silver lining, doesn't it?
The manager's turned it around a bit, Sally, but I'm not sure that's not necessarily a bad thing.
Okay.
And I will...
You've been fantastic. You are the only politician I know that has been clear.
God bless you, Sally, and please give my love to you.
And I'll do my best to ask the question of anybody who may be qualified to answer. Should we squeeze in one or two more, I think, if we've got time?
Thanks. Next call is from Tower Hamlets. It's Bill. Good morning, Bill.
Good morning, Sadiq. Good morning, James.
Hey,
I'll be brief. Both myself and my partner came down on Tuesday with all the symptoms of the virus. I rang NHS, explained what I had. They concluded that I had flu, despite the fact that my partner has had the flu vaccine. And I just find this, I'm concerned for two reasons. They basically said, no need to worry, once you get over the flu, you'll be fine. You don't need to take any specific precautions. And I find it interesting that a government minister who equally hadn't travelled abroad, their decision was based on the fact that I hadn't travelled abroad. It is now a pandemic. It's spread within the community. I explained that I spend a lot of time travelling around the London Underground. But as I said, how come a government minister who hasn't travelled abroad gets tested and the public can't get tested? Because I'm concerned about me infecting other people. Hopefully we'll get over it. But it is pretty horrific, the symptoms.
That's a strong question. I'm not sure you're qualified to answer it.
No, but can I check? So, Billy, are you and your partner self-isolating?
But we're at home. We're too ill to go out.
Right.
I'm in bed at the moment.
Right. Was the advice to self-isolate for 7 to 4?
No, the advice was we've got flu and just get over the flu and you'll be okay.
Did you speak to a person or was it via the website?
No, a person. Once I got through. I tried to ring them back this morning and I waited an hour and 15 minutes and couldn't get through to anybody.
So, Bill, I can't speak about the specific advice you were given, but I'm a bit surprised. But let me tell you the advice I received yesterday, because I asked this question of the Chief Medical Officer. So I think from next week, Bill, you've clearly still got a cough from your flu, but I think from maybe this week, we'll see what the press conference is after Cobra. But very soon, what the advice will be is there is no need to be tested. People will just have to make the decision to self-isolate for 7 days if they've got some of the symptoms, which the chief medical officer will tell us about when we move to the next phase. We've not reached there yet. There actually were reasons last week where not everyone was being tested. So if, for example, you've not been to one of the countries affected, they were giving the advice to self-isolate anyway as a prudent measure. I'm surprised that you were told you could go about your normal business except take the medication for flu.
We've heard this quite a lot, with
I'm
conflicting advice being received from the same sources.
No. And it was raised with me, actually, 2 weekends ago. So I raised it with the medical director at Public Health England. And that's one of the reasons why I asked Bill whether you got a human being or the website, because what they've moved to, because of the inconsistencies, actually, Bill, a GP rang up the 111 site and got different advice from one of his colleagues. And so, it's not just you and James talking about this, but it's a GP who rang the line and got different advice. So because of that, to get consistency, they changed their system, and they've got the 111 website, but also consistent advice. And I'm going to be visiting the call centre very soon to meet with some of the team there and stuff. So I'm very sorry on behalf of those who gave you the advice. It was the wrong advice from what you've said. People are being advised to self-isolate if they got symptoms akin to the flu. We're approaching the end now of the so-called flu season, where people get the sort of traditional flu, and that's another reason for, I mentioned, contained delay, to try and get that peak of the of the upside down U further away from autumn. And thank you to you and your partner for self-isolating, notwithstanding the wrong advice you received.
It's two calls there that are really worrying, and although, as we've used words like comforting and confidence to describe your support for the government's policy, every time I hear a call like this...
But let me be frank, and I've got to be honest with you, James, there'll be many, many calls like that over the next few weeks and months, and that's why we've got to be ready for this. And so the point I want to make is nobody wants to spread panic and alarm. Nobody should be complacent. But this will be a virus that's with us for a number of weeks, at least 13 weeks. It's going to go well into the summer. If we can get that peak further to spring and summer, the better chances we've got. But people like Bill and Sally and Joe and others who've rung in this morning, there'll be many, many more stories now, but I'm afraid that's going to go even higher over the course of the next few weeks. The key thing is for people in positions of power and influence to follow the best possible scientific and medical advice, and also learn the lessons from other countries, elephant traps to avoid, but practices we can emulate.
Let's just squeeze in one more, because Tom in Moorgate is, again, addressing an issue that feels, as you point out, increasingly urgent, while simultaneously it's probably going to become the new normal. Tom, what would you like to ask? Good
morning, Tom.
Hi, James. Good to speak to you again. I don't know if you remember, we spoke, I think it was last week.
Yeah, Tom is in a really high-risk category. He was in... well, you tell the Mayor, Tom.
Well, yeah, so I'm immunosuppressed, and I also have heart failure. But, I work full-time. I work in a sort of professional capacity, so, I commute in to London. And my sort of concern is, obviously, the chief medical officer, etc., is they're focusing on the big picture. And they're focusing on the majority of people who are healthy and who will, not suffer sort of significant harm from catching the coronavirus. But there's still a lack of specific advice for people in my situation as to what we should do. I have the ability to telecommute, but at the moment, the business I work for is not sort of recommending that we do that, and the expectation is we'll still go into the office. So that's what I'm doing. But in my particular situation, sure, I feel that I should be taking extra precautions and telecommuting sooner than other people, because the likelihood is that if I did get this, I would be much more seriously affected and therefore much more likely to require sort of mechanical ventilation or intensive care treatment. I know I check the sort of CDC and WHO websites regularly, and the CDC in America is recommending that people in at-risk groups actually stay home. But there's been nothing of that nature sort of put out in the UK, and if I look at what the UK is doing versus what the US is doing, it actually seems the UK is doing a lot more. So I'm just sort of surprised and worried by the lack of advice for people in my situation, because if you're an older person and therefore at risk, you're possibly not working and you're a pensioner, and therefore there's not this pressure to go to work and commute.
So the advice is, and that'll be made clear later on today, I'm sure, is for people like you who've got underlying health conditions to, take prudent steps, and that includes self-isolation. Already, employers across our city and across the country are getting ready for more and more of their staff to work from home. In City Hall, we've made sure that we've got facilities available, so if somebody needs to self-isolate because they could have caring responsibilities or underlying health conditions, can work from home. Lots of professions are doing that in the media, in not just radio, but newspapers and others as well. There are some jobs where we can't do that, so the police service, the fire service, the NHS, and so we're taking other steps to get those industries ready. So, Tom, I'm not sure about your particular case with the immunosuppression and the potential heart failure issues, but from what you've said, I suspect you're one of the sort of people that the experts would advise not to take the risk, because in case, God forbid, you get the coronavirus, and to speak to your employer about taking sensible steps. One of the reasons why I welcomed, in broad terms, some of the measures announced by the Chancellor, notwithstanding the absences of social care, etc., was he was announcing financial assistance to people like your bosses to help them during this difficult time. So, Tom, your health comes first. And, you should be speaking to your employers to make sure they make it easy for you to work from home. There are many, many jobs now where it's possible to work from home, to self-isolate and still do your job and still be productive without the need to take a risk with your personal well-being.
Does that help, Tom?
And post them too. Yeah, is there a written? Is it written somewhere officially that I can point them to that and say, look, this is the advice.
This is the problem.
So what you do?
Can I use it?
Yeah. So what happened today, Tom, is although I'm not at Cobra, I can guess what's going to happen. Is there'll be an announcement after Cobra in relation to us moving towards the next phase, and also, although, and it goes to Joe's question about the theatre, although I suspect they won't be advising to cancel all these events, they'll be saying if you're somebody who's at heightened risk,
yes.
And you're clearly somebody at heightened risk, you should self-isolate and not go to these events to reduce the chances of you catching it. And so, for example, if you're somebody with your conditions or elderly or has respiratory issues or other issues, probably don't go to the theatre this weekend or whatever in an indoor event. But for the rest of us who are relatively healthy, and if we got the coronavirus, the symptoms would be flu-like. There's no reason to change that. But James, what I suspect there won't be is a list of illnesses or conditions, because it gives the impression it's exhaustive and gives a false sense of security. But Tom, clearly from what you've described, also your self-awareness about your condition, I suspect you're the sort of category of people that should be self-isolating at that stage.
And that is really the best evidence yet of the absence of the definitive advice that many people are now craving. I sensed you were quite taken aback by Sally Coleman's call, and then, of course, Tom, who touched a lot of our listeners last week with his very clear and quite raw emotional response. There is a danger, and we've seen this in Italy, of vulnerable people almost being pushed out of the way because the official advice has to focus upon the herd, as it were, upon the massive majority of the population.
Let me deal with that. So one of the things that we know is for a small percentage of our population, between 5 and 10 to 15%, if they get the coronavirus, they may need inpatient treatment and what's been called, it's a euphemism for many things, ventilators. And the question is, do we have enough ventilators to look after that percentage of people who may become unwell? One of the reasons, by the way, Tom and Sally and Ian, for the Containment delay to get to spring and hopefully summer, is it frees up many of the ventilators currently being used. And I'm not going to criticise the fact that we've got fewer ventilators, but there is a capacity in the NHS to deal with, heaven forbid, people like Tom or Ian who may need to be hospitalised and need ventilators. Another reason to contain and delay this. But you're right. I mean, Tom and Ian are real life example of the consequences at one extreme of the coronavirus. I don't want anybody to be under any impression that there's a complacency from City Hall. We're in regular contact, often many times during the course of a day, during an hour, with Public Health England to make sure we can pass on to Londoners the best possible advice. What I think is not sensible, though, is an exhaustive list or us trying to pretend that we've got all the answers. We clearly haven't. And one of the other reasons, by the way, that Public Health England want to contain and delay is every hour they learn new things about how to deal with the virus, every hour, every day. So the more we can contain it before we get to the delay phase, the more the experts know, the more we can help.
Tom, take care. And
take care, Tom.
And keep in touch. And Mayor Khan, you keep in touch as well. So if you do, because I could see how moved you were by that one call in particular, given that you knew the person on the other end of the phone line. But if you do find out more information specific to Ian Coleman's case,
yes,
do pass it on to us, because Sally's call touched a lot of nerves with people in similar situations who perhaps, to be fair, actually Sally rang in, anyone can do that, but the other levels of access and interest perhaps are not open to other voters, other people.
Thank you. And message to Londoners is, keep safe. Go to the Public Health England website. They do regularly update it. I go to it many times. It is a very good website. And so also we'll be doing what we can from City Hall to make sure we get the messages to you loud and clear, and stay healthy and stay well. And thanks, James.
Sadiq Khan, many thanks indeed. We'll take some news headlines now with Thomas Watts.
Markets are suffering further heavy losses following Donald Trump's decision to ban flights from mainland Europe to the United States. The restrictions will come into force tomorrow and last for 30 days, but will not affect travel from the UK and